Hi there, this is Sumeet Sodhi, and welcome to the practical exercises section of this module. The learning objectives for this part of the module are to support you to develop research literacy skills by introducing you to a checklist-based critical appraisal tool developed by the Critical Appraisal Skills Program in the UK, and we'll work through some real-life examples. We also hope to help you in developing your research preparedness awareness for current and future pandemics and other health emergencies by exploring the different types of research studies that were undertaken by some of our family medicine colleagues during the COVID-19 pandemic. Before we dive into do a deep dive into the checklist, I just wanted to give you a bit of an overview of what we'll be doing during this module in terms of the studies we'll be looking at and the checklists that we'll be using. The Critical Appraisals Program, which we'll refer to as CASP, comes out of the Oxford Centre for Triple Value Healthcare, which is a social enterprise organization in the United Kingdom. Triple Value, according to this group, stands for Knowledge, Learning, and Solutions. And they've developed a whole program around helping us to critically appraise or really look at the research studies that we're reading and consuming. So these checklists that they've developed are free to access. They're free to share and adapt through an open Creative Commons license. So we will be using these checklists as a way to learn about critical appraisal. These checklists are used by many of our medical education colleagues. Like I said before, these checklists are available for many different types of studies: randomized controlled trials, systematic reviews, qualitative studies, cohort studies, case control studies, diagnostic studies. They even have one for economic evaluations and one for clinical prediction rules. So we'll be exploring two of these checklists today. The first type of study that we will have a look at is a qualitative study. And the qualitative study checklist from CASP is divided into three sections. The first section, Section A, has us think about whether the results and methods of the study are valid. And if we decide based on the checklist that the results and methods of the study are not valid, we don't move forward with the appraisal. We end the appraisal because the study design is not valid. But if we go through the checklist and decide that yes, the results and methods of the study are valid, then we go to Section B, which we actually look at the actual results and examine them critically. And then once we've completed that section, we move on to the third section, Section C, where we think about the impact of the results. Will the results of the study help locally? We've chosen an interesting study, qualitative study, to read and examine during this module. This is a research article that was published by some of our family medicine colleagues that looks at the impact of COVID-19 on chronic care according to providers. Qualitative study among primary care practices in Belgium. Before you move on, if you haven't done so already, it would be worthwhile for you to click on the link, have a look at the study, or even have a printout or the study open on your device, your electronic device, or your computer, so that you can refer to it as we go along. We're also going to be looking at a randomized controlled trial. So this is the randomized controlled trial checklist from CASP. This checklist has 4 sections. The first section is very similar to the qualitative study. We're asking the question, is the basic study design valid for a randomized controlled trial? And the checklist will have a few questions to help us figure out the answer to that. And if the study design is not valid, we end the appraisal because it's not a valid study design. But if it is, then we move on to Section B, the second section, and we look at the methods of this study. And we ask the question, was the study methodologically sound? And again, if based on the checklist questions, if we determine that the study was not methodologically sound, then we end the appraisal. But if it was, if we answer yes, then we move on to the next section and we look at what the actual results were. And then once we examine that and we're happy with that, we move on to the next section, section D, and we think about the impact of the results and consider whether the results will help locally. And the randomized control trial that we've chosen is a really interesting study that was published in spring 2021, which looked at dexamethasone in hospitalized patients with COVID-19. So again, if you haven't already, you may want to take a minute to pull this study up on your device or your computer, or have a printout available so you can refer to it as we work through the rest of the module. So let's get started first with looking at our qualitative study and going through the checklist together. So here's the qualitative study that we'll be working through. Like we mentioned before, it'd be good to have the study open or downloaded or printed off. But I've also put up the abstract of the study here. So if you didn't have a chance to do that, you could pause the video here and quickly read the abstract of the study. The other thing that might be helpful is to have the checklist open as well. So if you wanted to access the checklist and have either a printout or have the checklist open, you could go to the CASP website. It's casp-uk.net. So if you go there and pull up the qualitative study checklist, that may be helpful. If you can't, no worries. We're going to go through it and spell it out and go through it in quite a bit of detail in the next few slides. If you remember, the qualitative study checklist has 3 sections. Overall, there's 10 questions, and the first 2 questions comprise section A. And basically, these are kind of screening questions. So if you answer yes to the 2 questions in section A, are the results and the methods of the study valid? Then you can move on and do the rest of the checklist. If the answer is no, then you end the appraisal because the study design was not valid for a qualitative study. The 2 screening questions are: 1, was there a clear statement of the aims of the research? And you want to consider what the goal of the research was and why it was thought to be important and how relevant it was in the current context. Number 2, was a qualitative methodology appropriate? So basically, qualitative methodologies are appropriate if the research seeks to interpret or illuminate the actions, perceptions, or subjective experiences of the research participants. This study was called The Impact of COVID-19 on Chronic Care According to Providers. The last paragraph of the background section clearly states, this paper addresses a gap by examining primary healthcare response among primary providers in Belgium. The study aims to examine how both content and delivery of chronic care is being affected by the pandemic. So the answer to question number 1 is yes. In terms of number 2, is a qualitative methodology appropriate? Qualitative methods are appropriate for a research question that wants to explore perceptions of a group of experience. So this subjective experience, examining the subjective experiences in this way is absolutely appropriate. So the answer to question 1 and 2 is yes, and therefore we can move on to the other sections of the checklist. So we're still in section A of the checklist, considering whether the study results are valid. However, we still have a few more questions to go, although we want to move forward and think this is a good study to continue our critical appraisal. The next question is, was the research design appropriate to the aims of the research? So here we want to consider if there was a good justification for the research design. So for this question, we can't really tell. The researchers didn't explicitly justify the research design, but it's generally accepted that in the context of this particular kind of research question, a qualitative design and a thematic analysis would be appropriate. And that's what's described in the paper in the methodology. The next consideration for thinking about whether the results are valid or not is to look at the recruitment strategy and think about whether it was appropriate to the aims of the research. So here we want to make sure that the researcher has explained how participants were selected and why those participants that they selected were the most appropriate to provide access to the type of knowledge they were looking for. And just generally if there were any discussions around recruitment, any challenges or any barriers, and how they addressed them. For this study that we're considering, the answer to this question is yes. In the methods section, the authors state that they used purposeful selection in order to reach different practice types, and that the recruitment of participants was within an existing larger study. There is some discussion of the non-participants or people who chose not to participate, not in the body of the paper, but there is an appendix, an additional file, which gives the COREC checklist, and there in that tool there is a bit of a discussion as to why or why not certain people participated. The next section for determining whether the results are valid is around data collection and whether it was done in a way that addressed the research issue. So here we're looking to see if the setting was justified, whether it was clear on exactly how the data were collected and the methods were made explicit. For example, if interviews were used as a method for data collection, were they semi-structured? Were they done in a focus group? Was there an interview guide? And then also if the methods were modified at all during the study. Sometimes there is a justifiable reason for this to happen, and if it did, then we're looking for some explanation about how and why. For the study that we're looking at, the answer to the data collection question is yes. The setting is addressed in the context and study population section. The authors do describe that they did virtual interviews and that they used an interview guide, which is available as an appendix. They also stated that they reached saturation at 12 interviews, which is also an important consideration for qualitative research. They didn't make a statement as to whether methods were modified or not, but we're assuming that they were not. And the form of data collection was through doing recordings of interviews and transcription. The final question in the section around are the results valid is whether the authors considered the relationship between the researcher and the participants. This is an important part of qualitative research to critically examine your own role as a researcher, especially in terms of potential bias and influence during either or both the formulation of research questions as well as data collection. Also, we're looking for some reflection on how the researcher may have responded to events during the study and whether they had some self-reflection on the implications of any changes in the research design that may have happened along the way. In this study that we're looking at, the answer is can't tell. There is, in the COREC checklist, which is one of the appendices, there is some mention and consideration of the researcher-participant relationship, the fact that there was no existing relationship, which would decrease bias, but they didn't the authors didn't really explicitly explore potential bias or influence. Now we're moving on to the next section. So we've finished our consideration of the validity, but we're looking at the actual results. And there's three questions in this section. The first one is around whether ethical issues have been taken into consideration. So here we're looking at to see if the authors explained whether there are sufficient details on how the research was explained to participants for us to be able to understand whether ethical standards were maintained. We're also looking to see if the researcher discussed any issues around informed consent, confidentiality, or the effects of the study on participants during the study. And finally, often this is validated through research ethics approval. So it's important to note whether that has been taken into consideration. So for this study, the answer to the ethical issues consideration is yes. Ethical approval was addressed in the paper in the ethics declaration section at the end of the paper. So many journals and many conference abstracts will have a separate ethics section that's outside of the body of the paper. Sometimes it's in the body of the paper. There were some details on how the research was explained to participants in the correct checklist. The authors mentioned that they gave information handouts. So the next part of the checklist for the results section is the data analysis, and this is a big one. So we're asking the question, was the data analysis sufficiently rigorous? Here we want to consider if there was an in-depth description of the analysis process. Often we'll be using thematic analysis in qualitative research. So we want to make sure that we have a good understanding of how categories and themes were derived from the data. We want to know how the authors may have explained how the data were selected from the original sample or the transcriptions, so that we have a better understanding of the analysis process. We want to make some reflections on whether sufficient data are presented to support the findings, understand if there were any contradictory data. There usually are, and how they were taken into account. And we also want to know whether the researchers critically examine their own role, because there is a potential bias or potential influence both during the data collection phases, but also during analysis or selection of the data for presentation. So for this study, we've had to say no with some caveats for this. So the authors did use a thematic analysis approach and described it, which itself was rigorous. However, there was less exploration of how the themes were derived. They did mention that they applied a chronic care model framework, but it's not immediately clear how that was relevant necessarily or applied to the analysis. And there was really no mention of how contradictory data was handled or other issues of confounding bias or the researchers' roles or influence. The final question in this section around results is if there's a clear statement of findings. Here we want to consider if the findings are really explicitly stated and if there's adequate discussion of evidence both for and against the researchers' hypothesis or arguments. We also want to think about the credibility of the findings and if there's been any discussion around that by the researchers, and ensure that the findings are discussed in relation to the actual original research question and goals and aims of the study that was presented. So for this one around statement of findings, we selected yes. The discussion section really addressed explicitly the findings. In terms of validation, 2 separate analysts were used for deducing the findings, and the findings were in good support of the original research questions. The last question and the last section of the qualitative CASP checklist is for us to consider, will the results help locally? How valuable is the research? And here we want to understand the contribution of the study, what the contribution that the study makes to existing knowledge or existing learnings, putting it into context of current practices or policies or evidence. We want to see if the authors had any thoughts around identifying new areas where further research is necessary, and whether they discussed whether their particular findings could be transferred to other populations, or thought about other ways in terms of future impact of the research and how the research results might be used. So in terms of the answer to this from our perspective, the answer is yes. The research seemed to be quite valuable. The study highlighted gaps in the continuity of care during the COVID-19 pandemic and might be helpful for primary care practitioners that work in a similar context to plan around future pandemics. It's a bit hard to say whether this would be valuable for other settings outside Europe, as other settings may have different models of primary health care and different social or cultural environments. But overall, I think from my perspective anyway, I thought it was a well done study. There were some gaps in terms of that were highlighted by the CASP checklist, but overall a really interesting study that was really quite well done. All right, let's switch gears now and have a look at a randomized control trial. The study that we'll be looking at to go through the critical appraisal of a randomized control trial is a study entitled Dexamethasone in Hospitalized Patients with COVID-19. This was done by the Recovery Group out of the UK. You may want to pause for a moment and pull up the paper, or print it out or have it available on your devices. The other thing that you could do if you are able to is pull up the RCT, the Randomized Control Trial CASP checklist, and you can get that by going to the CASP website and searching RCT. When we're using the CASP checklist for the randomized control trial, there's actually 4 sections. You'll remember previously when we were talking about the qualitative research, there were 3 sections. There's just an extra section where in the RCT one, where we divide up the validity and the methodology a little bit more discreetly, just because of the nature of RCTs. So here you've got screening questions in both section A and B. So there's some screening questions when we're thinking about the basic study design being valid for an RCT, and if the study doesn't meet those screening questions, we end the appraisal right there because it's not a valid study design. We also have the opportunity to move on if the criteria for section A are met. Then we look at whether the study was methodologically sound. So again, if the study doesn't pass the screening questions, we end the appraisal because the study was not methodologically sound. But if it was, then we move on and look at the results, and which is section C, and then we look at whether the results have any kind of local or otherwise impact in section D. The first section, section A, is 3 questions, and really we're looking at whether the basic study design is valid for a randomized control trial. So the first part of this, question number 1, is around the research question and whether the research question was clearly focused through a PICO framework. Research questions don't have to be in the PICO framework, but it's certainly helpful for us when we're critically analyzing them to think about it. So PICO stands for population served, intervention given, comparator chosen, and outcomes measured. So the answer to question number 1 for our study on dexamethasone in hospitalized patients is yes. There was a very clear PICO statement. The P, the population, is COVID hospitalized patients in the UK. The intervention given is usual care plus dexamethasone, either oral or intravenous. C is the comparator chosen, and that's usual care. And then the outcomes measured is the mortality at 28 days. For the second question around validity of the basic study design is around randomization. Was the assignment of participants to interventions randomized? And here we want to consider and think about how the randomization was actually conducted. Was the method appropriate? Was it sufficient to eliminate bias? And was the allocation sequence concealed from investigators and participants? The answer to this question for our study that we're looking at today is yes. The study authors state that they had web-based randomization with concealment. So that fits all of the criteria. There were some small, so that means there was no systemic bias definitely in the randomization. There are a few limitations that we just wanted to highlight. One is that this was an open label trial. So the care providers and the patients knew what they were allocated, whether it was an intervention or control. The other thing is that some sites didn't have dexamethasone available and were excluded. So there may be some potential bias around selection as well. In the final question of section A, where we're looking at the validity of the basic study design, we want to consider participant follow-up. So here we're asking whether all participants who entered the study were accounted for at the end of the study. So specific considerations are things like whether exclusions after randomization or losses to follow-up were accounted for. Whether there was an intention to treat analysis. So that means when participants are analyzed, they're kept in the study groups to which they were randomized. And lastly, if the study was stopped early, why and what was the reason and what were the considerations there? In our study for today, the answer is yes. This was actually done extremely well by the authors. Exclusions were clearly discussed. The data set itself was 99.9% complete. So that means that pretty much all of the participants that were randomized and entered the study, we had an outcome measure for. They didn't explicitly use the intention to treat analysis, but I think that's probably likely because of the short duration of treatment. The study really was there was only a 28-day follow-up, and the treatment interval was up to 10 days, and the patients were largely in hospital. So that kind of accounts for all of that, and probably is the reason that this section was so successfully done by the team. So we've just completed section A of the RCT checklist. Is the basic study design valid for an RCT? And we've answered yes to all 3 questions, so we can move forward. Now we'll go on to section B and look at whether the study was methodologically sound. This section, section B, has 3 questions to help us to determine whether the study was methodologically sound or not. So the first one is around blinding. So this is whether either the participants, the researchers, or anybody who's treating, assessing, or analyzing the outcomes, whether they knew which intervention or which group the participant or the patient was in. So you're blind if you don't know. So there's 3 parts of this. This was an open label trial, which meant that the investigators and the participants definitely were knew which intervention was being given to the participants. It's not entirely clear whether the people assessing or analyzing the outcomes were blinded or not, but likely they were not. It just wasn't explicitly stated in the paper. Just because the participants, investigators, and the assessors weren't blinded doesn't degrade necessarily the validity of the methodology. The researchers did make it very clear that this was done, and the reason was because of the rapid nature of the study and the importance of getting the research done quickly. So it doesn't mean that we need to stop. So we can move on to the next question around whether the study was methodologically sound or not. And this is around the study groups at baseline. So often we'll call this a table 1. So here we're asking the question, were the study groups similar at the start of the randomized control trial? So what were the baseline characteristics of each study group, and were they clear? And were there any differences between the study groups that could affect the outcomes? For our study, the answer to this question is yes, with a few qualifiers. The intervention was allocated in a 2-to-1 ratio, where for every individual who received the intervention, 2 received usual care. So that's just an important consideration for the analysis, and the authors did take that into consideration. The other issue around differences between the study groups that could affect outcomes, there was one issue around the mean age, which was a little bit higher in the intervention group. So in the primary analysis, the authors didn't include it, but then I guess they noticed it, and they actually redid their analysis, adjusting for age. So they did take this into consideration in the end. The final questions in section B is around the study group intervention. So the question is, apart from the experimental intervention, did each study group receive the same level of care? Meaning, are we sure that they were treated equally? So here the considerations are around having a clearly defined study protocol, making sure that if there were any additional interventions that were given, that they were similar between the study groups, and that the follow-up intervals were the same for each of the intervention and the control group in this study. The answer to this question for our study was generally yes. So going through each of the points, there was a clearly defined study protocol. It's available as a part of the paper in a supplementary appendix. If there were any additional interventions given, respiratory support was variable, meaning was it, did people need extra oxygen or ventilation support? That was variable. It was clearly documented both in the tables as well as in the analysis of outcomes. And the last question is around follow-up intervals. The follow-up interval was equal and standard at 28 days. The intervention duration was variable according to sort of the clinical picture. So the intervention duration of receiving dexamethasone in the study was between 3 and 10 days. It looks like it's not 100% clear, but the primary outcome was assessed at 28 days for all the participants, whether they were in the intervention or the control group. So we're at the conclusion of section B, and we've generally answered yes. The study was methodologically sound. So we're going to move on to section C and section D, where in section C we'll consider what the results were, and then in section D later on we'll think about the impact, the local impact of the study and their results. Moving on to section C, where we're looking at the results, there's 3 questions in this section. So the first of these three, number 7, is around outcomes. And we want to know whether the effects of the intervention were reported comprehensively. So we're looking at, from a statistical point of view, we're looking at whether there was a power calculation, which statistical tests were used, were p-values reported. So all of those statistical considerations around creating inferences are important. We're also looking to make sure that the results were expressed appropriately and reported accurately, meaning we're looking to make sure that there's no missing or incomplete data, that there isn't a differential dropout between the study or the intervention group, and that the researchers have thought about potential sources of bias. So this is a big section, and we'll go through it one by one in the next slide. So the answer to this question for our study is a little bit complicated. It's yes and no. I think it's mostly yes, but there are a few concerns or a few limitations. So let's go through these points one by one in order that they're listed here on the slide. The authors did do an a priori power estimate. They wanted their power to be 90% and developed their study protocol based on that. The results overall were reported well. The primary outcome was survival, which is a binary outcome. They did do very, very clear statements of their statistical analysis. They did report relative and absolute effects. There was a potential confounder around respiratory status and respiratory support that they deduced, and we can see that in the table 1. So they did take that into account in the analysis. And probably because there was a short follow-up of only 28 days in a hospitalized patient, there really was no significant missing or incomplete data. And finally, the p-values were well reported. The one reason that somebody might answer no to this question is that bias and confounding could be better addressed. Really, they only collected essential data as this was a planned rapid assessment in the early days of the pandemic, and it is an important research question in terms of using dexamethasone for respiratory distress in a COVID patient. So they did justify sort of the limited data collection, but we're probably missing some nuances here because they weren't able to collect as much information or report as much information on some of the potential biases and confounders. The next question in considering the results is around precision. So whether the authors reported p-values or confidence intervals, one or the other, as a part of the study results. This overlaps a little bit with the previous question, but it's an important enough consideration that we want to really think about it and consider it and look for this kind of reporting. So the answer to this question is quite clear. It's yes. The authors used confidence intervals, and we'll look a little bit more closely in the next slide at the results, but there were very, very strong results in favor of the intervention of using dexamethasone having benefit. Speaking of benefit, that's actually the last question of exploring the results in section C. And here we're looking at whether the benefits of the intervention outweigh the harms and the costs. So we want to look at what the size of the treatment effect or the intervention effect was. We want to look at if there were any harms or unidentified effects reported for any of the study groups, the intervention or the control, and whether a cost effectiveness analysis was undertaken or not. So the answer to this question for our study is yes. There was a very overwhelmingly positive large treatment effect for the primary outcome, which, if you remember, is mortality at 28 days, meaning mortality of a COVID patient at the 28-day mark from the time of hospitalization was significantly lower in the intervention group compared to the usual care group. The rate ratio was 0.83 and the confidence interval was 0.75 to 0.93. So this is very, very strong and very, very clear in favor of the benefit of this intervention. The researchers didn't comment too much on the harms. There are some clinical and medical risks to dexamethasone treatment or using dexamethasone. However, with such a strong relationship to mortality in a COVID patient and the short duration of treatment with the dexamethasone, probably the harm versus benefit ratio is very much in benefit of using dexamethasone in this patient population. And a cost effectiveness analysis wasn't undertaken. The authors do reiterate that this was a rapid response to the pandemic. It was rapidly conducted research that they really only, I guess, in the spirit of doing things well and rigorously, but also quickly, they had to limit the kinds of data and the amount of data that they collected. So they didn't really proactively address this. I'm sure, though, that dexamethasone in most contexts isn't a particularly expensive medication, and the cost versus the benefit would also be in favor of the intervention. We're moving into the home stretch here. So the last section of the RCT checklist is around thinking about the impact of the results and whether the results will help locally and in other sort of broader contexts. In this framework, in section D, there's two questions when we're thinking about whether the results will be helpful or not. The first one is around local context. So we want to know whether the results can be applied to your local population or in your context. This is a bit of an individual question for every individual appraiser from a critical point of view. So you're thinking about how you're going to use this, perhaps the results of this in your work or in your context. So are the study participants similar to the people in your own usual care setting? Would there be any differences between your population and the study participants? And would that change the outcomes? Are these outcomes relevant or important to your context? Are there any outcomes here that you would have liked to have reported but haven't been, or that you would have liked to see studied but haven't been studied? And then are there any limitations of the study that would affect your decision as to whether this would change your practice or not? This is a bit of an individual kind of reflection, like I said, by the person who's actually appraising this article. So we put here can't tell, but likely yes. This study was done among hospitalized patients in the United Kingdom, which is a high-income country. So if you're from a different context, hard to know whether this could be applicable or not. But I think likely yes. There may be enough similarities amongst hospitalized patients with COVID around the world to make this an important study for other locations. The other issue here was there was limited additional data collected on patient characteristics. Again, the researchers justified this by stating that their goal really was to come up with high quality evidence for a very focused research question and to do it quickly so that it could impact care for COVID while we were still in the middle of the pandemic. And the other consideration around the impact of the researchers, the impact of this research is value over current care. So does the intervention provide greater value to the people in your care than any of the existing interventions? And then we think about sort of other issues around what resources are needed to introduce this intervention, taking into account time, finances, skills, or training required to implement the intervention, and whether local jurisdictions have the resources to move to adopt this intervention. Perhaps they would have to reinvest or move resources from one area to another, and is that justifiable or not? So I think the answer to this really is yes, across all contexts. Dexamethasone is generally inexpensive and available in many settings around the world. It's generally a well-known medication to be administered amongst hospital healthcare workers who would be able to administer it with very little additional training required. And in fact, this was a landmark study that was published in February 2021. The preprint was made available much earlier, and this study really did contribute to a change in the approach to management of COVID-19 in hospital patients around the world, and continues to be one of the mainstays of good treatment for COVID even now. In this module, we've gone through two types of studies that have checklists available for critical analysis. We went through the qualitative study checklist, and then we went through the randomized control trial study checklist as well. CASP has done a really good job, and they have a total of 8 checklists for various different study designs. Most of the checklists follow the section A, B, C format that we used when we were going through the qualitative study. So the first section has some screening questions, and we're looking at whether the results of the study are valid. Then there's a second section around examination of what the results actually are. And then the final section is around whether the study results will help locally. So this is a bit of a standard flow and format for how the checklists work. The RCT, the randomized controlled trial checklist that we went through, has an extra section. So section A is divided actually into 2 separate sections. So then there's A, B, C, and D there. That's the only difference. And the economic evaluation checklist also has 4 sections because with economic evaluations, we have to consider consequences, costs, and purchasing in addition to validity. But overall, this is a really nice tool that you can have available for you when you're reading a research study or trying to evaluate the literature, especially if you're trying to think about how it applies to your own context. So the checklists are a great tool for critical appraisal. There was one thing that was missing from the checklist that I thought might be an interesting thing to do some self-reflection around. And we did, in the discussions that I went through in going through the checklist, some of these did come out. But I thought it would be interesting to reflect on what some barriers and facilitators might be to both consuming or conducting research studies during a global emergency, like during a pandemic might be. We will be having a few coffee chats within a few weeks of launching the modules. So perhaps that can be a point for us to discuss during some of those coffee chats. Thanks so much for participating in this research module. If you have any questions or comments, there is a discussion board where you can post some questions, and we'll try to monitor that discussion board and get back to you. And like I think I said previously, we will be having some live coffee chats around the time of the launch of the module. So if you want to join us for that and ask your questions or give any comments, you're absolutely welcome to join us there.